Okay, so guys, welcome to introduction to nursing informatics. So this part of your nursing informatics lesson would introduce you as to how nursing informatics came about, what is the definition of nursing informatics, and why is it relevant or important in the practice of nursing. Now, to start, maybe I'm throwing this first question as how does the digital age impact us? Can you share some phrases on the screen, on chat, as to how the digital age have impacted us or influenced us in our activities of daily living, or perhaps in the hospital setting, or in any aspect of our lives? How do you think was digital age able to impact us? Anybody? I would want to see your responses on chat. How does the digital age impact us? Maybe a phrase or maybe some examples there of how this digital age impact us. I'm waiting for your responses. Sige na. How did the digital age impact us? I would want to see your response. When we talk about digital age, it talks about computerization, digitalization, the Internet of Things. Okay? Angel said that the digital age made our work easy. Joanne, yes, it influences our daily lives. Yes, Angel, it makes life convenient and easy. Other ideas, please. Sige, I would want to see other ideas. They make our life easier. Example on recordings. Really? And sige, what else? Is there somebody here who is fond of using TikTok, Instagram? Okay, what do you call that? Stories. You post stories. You post reels. Are you doing that? Okay, so if I would look at the responses that you have, you're saying that the digital age is making our lives easy. Easy. Perhaps the most common response here is easy. So true to that, that's also the same purpose of nursing informatics. It's supposed to make our lives easy. Okay? But come to look at it, what's the reality now? What's the reality? When I will introduce a new technology in the hospital, the tendency of the staff nurses, the tendency of nurses across ages would say, oops, may something new na naman, hindi naman yun mag-work. Something new is always difficult. Okay, there are people who would think like that. No? But I would like to capture the idea that you have given us that when we talk about digital age, when we talk about technology, its main goal is to make our lives easy. If the technology is making your life difficult, that only means that you're not using the technology correctly, or you are using an inappropriate technology. Again, kindly write that down. If that technology makes your life difficult, meaning you are not using the technology correctly, or you are using an inappropriate technology. Okay? Technology is made by man, guys, to make our lives easy, to make our lives simple. It's not intended to make it difficult. So if it's becoming difficult, there's something wrong on how you're doing it. Now, in our case as nurses, why is there a need for us to study nursing informatics? No? So, di ba, in the past, hindi naman siya na-study. Tapos some would say na, kami, naging nurses naman kami. We do not know about nursing informatics. So maybe some of you will say it's already the trend. But here are the reasons that are being given to us. One, nurses are major stakeholders in the healthcare. When we talk about major stakeholders class in the healthcare, meaning class nurses are considered to be prime movers in the healthcare. Pag sinabi kong prime movers, when we talk about healthcare and nursing, healthcare could not go on without the nurses. Okay? It's the nurses who are able to understand the holistic nursing care of the individual. And when we talk about holistic nursing care class of the individual, example lang ha, example. Okay? When we are caring for our patient needs medicine. If we would want to give the medicine, dear students, on time, and then if we would want to give the medicine correctly, it is your information technology that will be able to help us do it. Okay? Now, if the nurse does not know how to request the medication in the computer, how can she administer the nursing care that is being needed? If the nurse does not know how to type, how can the nurse take down notes in the computer if what is happening to the patient? And then plus the old nurses will answer, sir, meron namang papel at saka ballpen. But if you would look at the paper and the ballpen, by the time that the paper is gone, no more. By the time that you need to have endorsement, for example, if I'm endorsing to Marian, Marian would need to write it again because Marian might not want my handwriting. And then Marian might misinterpret my handwriting because she does not clearly understand it. It is your computer who's able to do away with that. Then other than that, class, when I say major stakeholders, your nurses knows what's happening to the patient 24/7. Okay? Alam natin kung anong nangyayari sa patient natin 24/7. So we know if the computer is doing the right thing, if the system is doing the right thing, or if the system is in haywire, or kapag yung system natin naglalag, we're able to understand it. Then other than that, the nurses can translate data to information, information to knowledge, knowledge to wisdom. What do we mean by that? No? Come to look at it. No? If hindi po tayo healthcare professional, iniisip lang natin, for example, okay, let's take for example, we do not have background in health. If we know that somebody has fever, right away we might be thinking that that person may have infection. Right away iniisip infection kasi common knowledge daw kapag may fever, may infection yan. That may be true, di ba? That's true, no? True yan. Pero kung ikaw ang nurse, no, pag nakita mo ang pasyente mo may fever, di ba hindi ka contented sa information na may fever lang? If you can recall your health assessment, you would need to collect subjective. What's the other data? If I'm collecting subjective, what's the other type of data that I need to collect?
Objective.
Okay, you need to collect also objective data for your patient. No? So you need to collect both subjective and objective data from our patients for us to really know what's happening to our patient and for us to make a valid nursing diagnosis. So guys, it is the nurse who are able to do that. Okay? Because with your knowledge now, with your knowledge in fundamentals of nursing health assessment, you should have understood that when we talk about fever, it's not only all about infection. Okay? My patient may have severe problems. That's not only infection. My patient may have a problem with the brain, okay, while having fever at the same time. So we are considering that. In other words, guys, no, the nurse collect the data and the nurse turns that data into information, turns that information into knowledge, and that knowledge is being turned into wisdom. Okay? That's the role of the nurse. No? So we are not contented with the data alone that we have. Now, class, if you would look at there the words, that would already go to your DIKW. Okay, which we will discuss later on. So you have your DIKW theory or model. Okay, so we will be discussing that. So at this point, you should understand that if the nurse knows what's happening to the patient, if the nurse knows how to deal with this data, she will be able to process the data through the use of information technology. Okay? Parang ganito, guys. Pag may computer ako, tapos na-type ko dyan, the patient's temperature is 38.5. If wala class knowledge ang nurse, walang knowledge ang nurse informaticist, 38.5 is just a number in the computer. Okay? The computer will not be able to tell you, oy, fever, you need to order paracetamol. No. It is the nurse that will be able to process this data. Okay? That's why, guys, actually, in the formulation of the system, this is already in the advanced ng mga informatics. No? In the formulation of the system, there is always a nurse on the background because it is the nurse who knows what needs to be done in the system. In our case here, as beginning nurses, by the time that you will graduate, you need to learn all of these things so that you will be able to administer safe and quality nursing care to your clients later on. So, in this chapter, you are expected to define and describe nursing informatics, information science, and information system. And then, of course, discuss the historical antecedents on nursing informatics. Sure, may history, gidya. Kaya sa class, hindi nawawala ang history in any subject, kaya in any subject matter, because your history would make us understand how it came about. Now, if you would look at the history of nursing informatics, the term in 1956 was used by Carl Steinbach. He used the term informatics. In 1962, Dreyfus has already mentioned informatique. And then Bauer made the term informatics. In 1980, it was Scholz and Barber who used the term nursing informatics. Okay? So class, look at the dates. 1956, unang ginamit yung term na informatics. Pero history would show na 1980 na nag-emerge yung nursing informatics. And then if you would ask me, when did it reach the Philippine grounds, guys? It's already in the 20th century na nakarating siya sa Philippine grounds. Okay, it was on 20,000 and beyond that it reached the Philippine grounds already. Okay? If you would look at the distance there of the dates, that would tell you how difficult also for the people to develop the technology. Okay? Look at Steinbach. Steinbach was actually a German computer scientist when he first used the term informatics way back in 1956. Now, let's look at the definition of nursing informatics. The big words there that you need to highlight is nursing, information, and computer sciences. Okay? In the board examinations, it's being repeatedly asked, what is nursing informatics? So it's a combination of nursing science, information science, and then computer science in one. That's your nursing informatics. And the purpose of it is to manage and process the data into knowledge in nursing practice. Okay? Again, class, look at the term. The purpose is to process, okay, the data, to manage the data, to process the data for it to become knowledge. Class, pag titingnan nyo, babalik din naman siya sa DIKW. In this case, nag-mention lang siya na data would become knowledge. Okay? Now, take for example, if I have a list of 10 patients, and then I take note of the weight of these 10 patients. Now, I took note of the weight of the 10 patients. Let's say, for example, 60 kilograms, 70, 80, 90 kilograms, 90 kilograms, 90 kilograms, 100 kilograms, 90 kilograms, 95, tapos 98 kilograms. If I would just look at these numbers, dear students, those are data. If I would look at those numbers, those are data. Okay? In fact, those are the very things that we input in the system. Diba? That is the thing that we would encode in the system. What is the weight of the patient? 86 kilogram, 70 kilogram. We type that in the system. That's the data. What will be the goal of the system? Plus, your system will be able to process that data. It will be able to combine that data along with other data. For example, class, ang system would have the height, the weight, and then later on, the system could automatically compute for the BMI of your patient. Okay, by the time, class, that the system is already computing for the BMI of your patient, the system is giving you another information and another knowledge about this data that you have collected. So kung titingnan ninyo, in the practice of nursing and even in medicine, it is not only the data that is important, but we need to be able to we need to be able to process this data. Now, other than that, other example that I can give you is that from this data, guys, from this data, halimbawa, you have all the weight of the patient. What can I conclude there? Kung titingnan ko lang yung weight, okay, 60, okay, 70, 80, 90, they are just numbers. Pero plus, if you will be able to collect it later on, and then the system plus will be able to give you an analysis, they might be able to conclude that majority of your clients are overweight. Okay, this is information and this is already knowledge that we are getting from the data. And that is the purpose of our system in nursing informatics. Okay? Kung baga, class, you give the system the data will be analyzed by the system, the data will be processed by the system. Okay? That's one purpose of your nursing informatics, the definition of your nursing informatics according to Murphy in 2010. Now, look at it again. Nursing informatics is a specialty that integrates. Ulit-ulit lang yan eh. Okay? Nursing science, computer science, information science. Okay? And look at this, nag-rephrase lang. Manage and communicate. DIKW. And this is the definition from your American Nurses Association. So as you can notice, it seems to be a rephrase ng class. Okay, so that's the important point still. Now, this one is from AMIA, which says that nursing informatics science practice integrates nursing, information knowledge, and their management with information and communication technologies to promote the health of people, families, and communities worldwide. Plus, pag titingnan nyo to, you don't need to memorize those, ha? Pag titingnan nyo, class, no, ang na-mention pa rin is integrates nursing, information, okay, and then you have your communication. So it would still go back to nursing, information, and computer sciences. Now, what's an important thing that was emphasized here in the definition of AMIA? Class, look at the term promote. Promote the health of people, family, and community worldwide. Okay? If you would look at students, the 4 pillars of nursing or the 4 key tasks of nursing, di ba class sinasabi that our main goal is to promote health, to prevent illness. What are the other 2? Promote health, prevent illness. What are the other 2, class, of the 4 functions of nursing? Promote health, prevent illness. Ano pa? I don't know if you've encountered this, cure, and then you have your rehabilitation.
Prolong life, sir.
Thank you for that input, ha? Pero class, the 4 class is promote, prevent, cure, and rehabilitation. Yan po yung 4 purposes ng nursing. Promote health, prevent illness, cure disease processes, and then plus rehabilitate in case cure is not possible. Okay, so promotion, prevention, cure, and rehabilitation of illness. So yan po yung 4 na major purpose natin sa nursing. Now, your AMIA was able to capture the first one, no, which is the promotion of health. Okay, so class, pag sinabi nating promotion of health, we use your informatics to disseminate information to your patients. Okay, if you have been seeing the data class given to us by the Department of Health during the time of the pandemic, di ba class, now for the time of the pandemic, na nakita ninyo class that during the time of pandemic, anong tawag natin dyan? You have seen data, you have seen graph being given to us by the Department of Health. Plus, ang mga data and graph na is already an application of your nursing informatics. Okay, they are already in application of your nursing informatics. Sige, another definition. Nursing informatics is a specialty. The keyword here that you will be able to capture is special. Okay? When I say specialty class, after you graduate, you can already have special training and then you can become nurse informaticists. Many hospitals abroad are already employing nurse informaticists. Here in our setting, depending on the qualification of the nurse, may mga hospital na rin tayo locally, that nurses who are technologically savvy are usually placed in the information technology department. Okay, so class, it's a specialty, meaning with additional training, with additional certification, you can be referred to as nurse informaticist. Okay, you can be referred to already as nurse informaticist. O, yan na naman, ulit-ulit, nursing science, computer science, information science, DIKW in nursing practice. Okay, so that's important there, Important thing there is the word specialty. Now, nursing informatics and healthcare. What happened now? What happened when it comes to nursing informatics and healthcare systems? Class, at present, they're already rapidly changing technological advancement. Okay? Very rapidly changing na po yung technological advancement. What may be true this year will not be true na by next year. No? What may be true by this time, by the time that you graduate, hindi na po ganyan yung application or hindi na po yan yung true. So because the technology is rapidly changing. So what happens, As nurses, we need to be able to adapt to these technological changes. So that would go back to the emerging skill that is being referred to as resilience. Okay, that would go back to your skill being referred to as resilience. So class, oftentimes actually, especially on the older generation, it is very common for us to hear notion that, this is not judging, or this is not stereotyping. But by observation, I would commonly hear people who are aged, for example, 40 and above. I don't know if you've heard this, but oftentimes they will say, "Ay, new technology, we don't want that." Diba? Or have you encountered even in your parents wherein they would not want to learn computers anymore because for them that's already difficult? Have you encountered those things? Diba? Or you
Yes,
will
sir.
encounter, no, diba? You will encounter your lola or lolo who would say na, ay, ayaw ko nang mag-learn ng cellphone. No? Okay, they would want to see the video in YouTube, but they don't want to know how to click it because they just simply want na makita lamang sa TV. Na. But these are traits of those generations. But at the current era, students, you need to have resilience. You need to have resilience. Okay? For example, Juliana, Marian, and then others, no, may be learning this type of technology right now. But in the future, baka iba na. Halimbawa, class may be conducted through Zoom right now, but later on, it may be already in virtual reality. Or maybe you would have an anagram, or you would have a stereotype there, or a robot doing the discussion. Okay? Now, there is also a simulation of technology at a quick pace. No? That's pace. No? So in other words, masyadong mabilis yung pag-assimilate po natin ng technology. Then, security and data privacy is already becoming a big concern. With the advent kasi of technology, okay, with the fast technology that we are having, okay, many problems on data privacy are also emerging. So guys, that's why even despite the advancement of technology, there should be always the human side of it. Okay? Dapat class, the human side of it is always there. You should always have your values and the virtues that we are reminding you of. Okay? Class, even how good the technology is, okay, it can be used for bad purposes. It can be used for bad purposes. For example, if you're having our duty and then I've given you access in technology, okay? For example, Paula has her own username and password in the hospital, for example. Can Paula share that username and password to Ira or maybe to anybody else? Is it okay ba to share the username and the password to anybody else?
No, sir.
Okay, so class, hindi, no? Hindi. But then commonly nangyayari yan. People are doing that. They are sharing things, no? They are sharing things and passwords to others even though it should not be done. Okay? So that does not go back to technology, but that goes back to how human we are. Then for example, if your patient had fever, okay, in Funda, what is your intervention? Pag may fever yung pasyente natin, anong dapat gawin natin, guys? 3 letters yon. What do you call that? What should be done if my patient has fever? Yes, anybody? What's your independent nursing action kapag may fever si pasyente? Anybody, guys? What's your independent nursing action? Ay, wala na. Sir, last time pa kasi ang Funda, no? Ginlet go na namin. Guys, what could be done? If your patient has fever, what should be done? Sige na.
I-sponge bath pa sa sir.
Okay, yeah, you do your tepid sponge bath, no? You do your TSB. If your patient has fever, you're doing your TSB. So class, if you have your computers later on, no? So if, for example, if you have your computers or your tablet, you need to note there on your tablet that your patient had TSB. Okay? So even if I have the computer, my computer makes life easier because I don't need to do a lot of writing. I will just click tepid sponge bath. But if the nurse does not have the consciousness to do the documentation, useless. Okay? It's just technology. Okay? The common question that is being raised actually when we are having meetings and conferences when it comes to the nursing and technology, the common question being raised is, can robots replace nurses? What do you think, guys? It's a yes or no. Can robots replace nurses? Palagay nyo, can robots ba replace nurses, guys?
No, sir.
No,
What
sir.
other? Hey, no. I would like to borrow the words of one of the speakers of the webinar that I've attended. What was his response to that? He said, bad nurses can be replaced by good technology, but good nurses can never be replaced. Again, bad nurses can be replaced by good technology, but then good nurses could never be replaced. Okay? So class, if you're thinking that robots can replace us, It's just like thinking that you're thinking of nurses as robots. I don't know if who among you here have been in the hospital setting. If you have seen nurses, for example, who will just get inside the room, pagkatapos the nurse will not even say good morning, good afternoon. The nurse will just get inside the room, give medications, and then go out. Can that be done by a robot? Di ba pwede? Di ba pwede? No? No?
Yes,
The
sir.
robot, for example, the robot will just enter, and then the robot will give medication, and then the robot will go out. That can be done by the robot. But because that is not nursing care. When we talk about nursing care, when you enter the room, you know that you should knock first, you should introduce yourself. Okay, you should explain to your patient why they are giving that medication. You are even being taught of therapeutic touch. You give time to talk to your patient, then you give the medications. That's how a good nurse should be. Okay? Pero class, if you will follow the example that I have given earlier, enter the room, regulate the IV fluid, then go out. That's better to be done by a robot and not by a nurse. Okay? So take note of that. Good nurses could not be replaced, but bad nurses could be replaced by good technology. Then other than that, you also have the integration of your EBP. Anybody who can give me what's the definition of EBP? Okay, anybody who can give me what's the definition of EBP, guys? Okay, evidence-based practice. No? Very good, evidence-based practice. In other words, hindi pwede na, ay, let's do that because Lola Nurse usually did that. No? Let's do that because according to Lola Nurse, ito yung dapat gawin. Hindi pwede. Huh? You could not even say that, let's do that because in the United States, that is how we do it. Hindi po pwede. No? Hindi po pwede. Dapat evidence-based practice po tayo. Okay? So we need to do your evidence-based practice. In other words, may ebidensya. Or what do we call that evidence? What's the most common evidence that we lean into? Maybe your favorite subject way back in senior high, and then your favorite subject next semester. What do you call that? Ano po yung main evidence na ginagamit natin? Very good, Jo. That would be your, okay? That will be your research. That will be your research. Okay? So class, diba, no? Hindi na pwede na sabihin mo na, ay okay, let's play some lapunaya because the lapunaya is effective. It needs to be backed up by research. Okay? We need to wash the wounds with bayabas because bayabas is effective. It needs to be backed up by research. And actually, research shows no, that your boiled guava, your boiled bayabas could actually be good to clean your wound. Okay? May mga research yan, class. No? That's why we recommend that to our patients. In the same way, we use evidence-based practice in the use of your computers. No? That's why, class, there are already researchers that are showing that nurses daw have more times on the computer. Nurses daw are having more times on the chart rather than taking care of their patients. That's why your computers is trying to make our lives easier so that your time will not be your time will not be more on writing, your time will not be more on taking care of those notes. No, dapat most of your time will be spent towards the patients. Okay? So those are the things, those are the things that we need to remember. We always look into evidence-based practice. Now, still more on nursing informatics and healthcare. Plus, your nursing informatics and technology would be able to help us identify potential problems earlier due to readily available information. One example for that, class, is what we refer to as your telemetry. Okay, one example of that is what we refer to as your telemetry. When I say telemetry, class, maybe you can picture out a cardiac monitor, no? So class, cardiac monitor. Pag sinabi ko cardiac monitor, nandyan yung ECG tracing ng patients natin. So class, with information technology, you can actually already see in the computer in your nurse's station what's happening to your 10 patients across the ward. Okay, you'll be able to see, oops, nag-abnormal ang ECG. Oops, parang impending heart attack si patient. Oops, impending myocardial infarction si patient. Okay, for those of you who have not yet encountered the term, so class, myocardial infarction would usually is the medical term for what we commonly refer to as your heart attack. No? Okay? So myocardial infarction. So class, it's the technology that will be able to help us detect that. No? In the past, daw parang hinihintay pa na medyo malala na yung condition ni patient before it can be addressed. But with your technology, it can be able to be identified earlier. In advanced settings, no? For example, if I would note in my phone that my patient has difficulty of breathing, my patient has low oxygen saturations. I hope you're familiar, class, with oxygen saturations. So when we talk about O2 saturations, class, your oxygen saturations would be playing at 95 to 100. Okay? Have you seen that? Yung iniipit sa fingers ninyo? Have you seen that? Okay, your pulse oximeter, you call that your pulse oximeter. So that would be able to get your oxygen saturations. No? So, plus, sa advanced settings na abroad, for example, nag-note ako sa phone, oximeter reading is 84. Right away, class, the doctor will be prompted in his phone that that's happening. Okay, right away, the doctor will be prompted that that's happening. So, what does it do? It makes care faster. It makes care more efficient. Pagkatapos, no, for example, kahit simple vital signs lang, di ba? As nurses or student nurses, commonly, kumukuha tayo ng vital signs. Plus, di ba kung sa hospital, if you have been in the hospital na, no, makikita nyo yan sa hospital, for example, vital sign, fever, 37.8. The nurses are still graphing it. Okay? Naghahanap pa yan sa linya. Saan nga ba yung 37.8? Pagkatapos, next shift, 38.2, pag ganyan. No? Class, abroad, in advanced settings in informatics, will already be able to see in your cell phones, in your tablets, what's happening to the vital signs of the patient through a graph. Okay? Naka-graph na yan, automatic nakikita. And then the doctor will be able to see, no? Okay? If you can recall in health assessment, di ba may characteristics tayo ng fever? Can you recall still that? Naalala nyo may mga characteristics ng fever? Di ba may fever na steadily increase? May fever din na nagsaspike, nag-increase, decrease in your health assessment. Okay? So plus makikita ng doctor, oops, the fever trait is like that. Let's explore the possibility that the patient may have typhoid. Okay? Parang ganun, no? With that, you'll be able to discern already. Then, standardization of nursing language. What do we mean by that? Give me a nursing diagnosis. Sige nga guys, give me a nursing diagnosis. There are hundreds of nursing diagnoses based on NANDA. Give me a nursing diagnosis. Hoy, nursing diagnosis. Sir, ano po yung nursing diagnosis? Babatukan ko kayo, part 1, part 2. Sige na guys, keyboard warriors, find me a nursing diagnosis. If you forgot plus your nursing diagnosis, try to search nursing diagnosis and then give me nursing diagnosis. Sir, okay lang ba mag-search during class hours? Yes, it's still learning. No? If you are searching and then you give me the answer, that's still learning. You can do that. O sige na. 5. Ineffective airway clearance. Very good. That's a very common nursing diagnosis and in fact, one of our priorities na, ineffective airway clearance. So class, anong ibig sabihin ng standardization of nursing language? When I say ineffective airway clearance, regardless in what school you're studying, it's still ineffective airway clearance. May definition siya, kaya may characteristic siya kung ano yung ineffective airway clearance. Okay? So regardless, if you will be working in Australia, if you will be working in Japan, Singapore, wherever that may be, ineffective airway clearance is ineffective airway clearance. That is one of the goal class of your nursing informatics, no? Standardization of nursing language. Then next, you have template. Pag sinabi nating template class, parang may form na, parang may pro forma na kung ano mga dapat i-collect mong data. For example, if your patient is for OR, i-click mo lang, patient for surgery. Nakalagay na dyan, anong dapat mong i-collect? Name. Tapos nakalagay, dapat mag-ano ka ng ID bracelet, mag-attach ng ID bracelet. Tapos i-check mo na lang. Tapos nakalagay, dapat mag-standby ng blood. I-check mo na lang once that blood is already available. Okay? Kumbaga, plus, there is a template that would remind you what are the things that needs to be done. Okay? In the past, of course, may listahan ka mo, meron kayong papel na hinahawakan pagkatapos i-delete or kaya i-check. Pero class in nursing informatics, you'll be able to tick it already in the computer. Now, one reminder that I would like to give you is that you do not click check in the computer if you have not done it yet. Again, you do not click check in the computer if you have not done it yet. Yan naman po ang common pitfall ng mga nurses when it comes to the use of technology. Okay? There are those kasi class who would say na, ay okay, i-click mo na lang, ha? I-click mo na lang yung check kasi later on, once you have clicked the check, you will be able already to, para later on, automatic may check na siya. Class, hindi po ganyan sa nursing informatics. Ha? We are not teaching you to document in advance. Diba? One of the rules that are being reminded for you in the fundamentals of nursing is that do not document in advance. Example, right now it's 10 a.m. Is it okay for me to sign my medications by 12 noon? Kasi ibibigay ko din mamaya sa kanya. Pwede ba yon class? Yes or no? 10 a.m. pa lang. I will say, sige,
No, sir.
i-sign ko na by
No,
12
sir.
para later finish na ako. Can I do that? No, no? So in the same way, when we are using technology, are we allowed to do that? Of course, no. Ha? Hindi po pa pwede, no? Nasabihan mo ay 10 a.m. pa lang. Sige, 12 noon, given. Hindi po pwede. Okay? So you will be audited and it will be found out later on that you are not doing it right. Some of you might say, sir, bakit hindi pwede? Gagawin ko din naman yun later on. Plus, we are not asking, but what about if the patient would vomit? The patient would be an NPO. What about if the patient had cardiac arrest? And then you signed that you gave this medication by 12 noon. Whereas bawal na sana yung medication na yon for the patient by 12 noon. Okay? Plus, in the clinical setting, anything can happen within 5 minutes, within seconds, your patient's condition may change. Okay? So dapat po, do not document in advance. Then class, other than that, research studies, patient care data, national and local standards may be also formulated. For example, during the time of COVID-19, don't you know that the DOH is also tracking class, no? The signs and symptoms of COVID-19. Para lang class na ma-document kung ano ang common na signs and symptoms of those patients with COVID among the Filipino people. Okay? Class, kaya yun yung basis, di ba? Na pag sinasabi na kapag umuubo ka, isolate. Okay, quarantine ka muna because the most common sign of symptom of COVID is cough. Where did that come from? That's from the national and local standards. If you would review your lessons in CHN, di ba may tinatawag tayong FHSIS? Okay, I don't know if you've heard that in CHN. That's a concept actually being introduced in CHN. Class, ano po yung purpose ng FHSIS? No? Class, your FHSIS is actually inclined, no? Your FHSIS is actually inclined on the reporting of the data. Okay, so class, your FHSIS stands for Field Health, okay? Field Health Information. Field Health Services Information System. Field Health Services Information System. Class, anong nangyayari? If you are living in Barangay A, for example, would note, this is the maternal mortality for this period. This is the neonatal mortality for this period. All of the barangay reports will be submitted to the municipio, to the municipality. All the municipality reports will be submitted to the province. All of the province reports will be submitted to the national level. That allows our Department of Health to make decisions on the programs that needs to be done. Okay? So baka you would think itong Department of Health parang palagpatisam, or itong Department of Health parang naghuhula-hula lang kung anong programs yung gagawin. So no class, they have a basis for that. And actually, it's nursing informatics which are helping them to make the decisions. Because these decisions, students, will be cascaded to the national level in a shorter period of time. Kaya kung na-notice nyo, no, pag increase ng cases ng dengue, right away the DOH would initiate programs to prevent the spread of dengue. They would trigger barangays to do cleaning drive, things like that. Okay, that is driven by the data that is being collected through the system. Then other than that, no, okay, what is ba the new definition of nursing informatics? No? May new definition pa. This is Taggart and Thompson 2002. Plus, in this definition, they mentioned that the goal of nursing informatics is to help improve the health of population, community, family, individuals by optimizing information management and communication. Ano pong ibig sabihin ng optimizing information management and communication? Plus, pag sinabi kong optimizing, it simply means making use of the data. Okay? Making use of data. Now, example, you know that a lot of people is overweight. If you know that a lot of people is overweight, you need to have education drives for overweight. So hindi siya pwede na, okay, overweight sila, thank you for the information. It's not like that. No? In nursing informatics, we make use of the data. So, for example, the patient has fever. Do something about the fever. Assess the patient further. Or for example, the WBC count of the patient is high. Do something about it. Don't just leave it as an information. You need to optimize that data. Okay? Now, what are the activities that are being included? One, design, use informatics solutions and technology to support all areas of nursing. Kita mo class, nurses already involved in the design and use of informatics solution. Second, direct provision of care. Okay? Direct provision of care is always there. Okay? Now, come to think of this, guys, no? Have you seen movies naman, di ba? Have you seen movies wherein they do the CPR? Have you seen that? Can I see cardiac, can I see heart reacts? Kung sino mga nakakita doon sa movies. Di ba? Yung mga nag-cardiac arrest sa mga telenovela, di ba? Nag-cardiac arrest tapos nagsi-CPR. No? Plus, halimbawa, nakita mo class sa cardiac monitor. Si sir lang muna mag-drawing ng cardiac monitor. No? So, class, nakita mo sa cardiac monitor. Normally kasi guys, pag ganyan yan, ano? Di ba? May parang pag ganyan-ganyan. Okay? Baka kayo nga may mga necklace pa kayong pag-ganern. Tapos class, nakita nyo class sa cardiac monitor. Nakita sa cardiac monitor, flat line. Nag-flat. Okay? Di ba class, pag nag-flat, you are parang impression natin patay yung pasyente. Okay? Now class, flat yung cardiac monitor, no? Flat again, ha? Flat yung cardiac monitor. Nakita mo sa station, flat yung cardiac monitor. Pagpunta mo sa patient's room, patient is awake, alive, enthusiastic. You are even able to talk to the patient. So students, what would you believe? Is it the cardiac monitor or the patient? Cardiac monitor nga ba or pasyente yung paniniwalaan natin? Sige na. I would want to see yours.
Patient, sir.
Patient, sir.
Patient, sir.
Okay. Sir, posible po bang mangyari yan? Yes, guys, in about 5 years that I have been in the hospital, that happens. No? That happens. Okay lang. I appreciate those who answered cardiac monitor. Okay lang. I understand where you're coming from. Because we are often taught that the technology is what is accurate. The technology is what is best. No? So we are oftentimes taught like that. No? The technology kasi accurate yan. Technology kasi best yan. Okay? So class, ang isipin po natin is that we do not treat the computer, we do not treat the machine, we treat the patient. Okay? Again you do not treat the machine, you treat the patient. Ano pong ibig sabihin yan? So sir, posible pala na ang cardiac monitor flat pero ang pasyente natin okay. Yes. Okay? What could be one possible reason? Baka class na-detach lang yung cord. Okay, baka na-detach lang yung connection, kaya nga flatline yung lumalabas. Okay, na-detach lang po yung connection, kaya flatline po yung lumalabas. Kaya, when that happens to you, when you saw the cardiac monitor to be flat, right away, what would you do? Assess your patient. Okay, assess your patient. That's what also informatics reminds you, that you need to do direct provision of care. We do not treat the machine, but we treat the patient. So sa example na binigay ko, if the patient class was awake, alive, enthusiastic when you entered the room, then the patient is okay. You just need to check whether the cardiac monitor might be detached from the patient. And you also need to assess the patient whether kung may na-feel ba siyang iba, Okay, whether your patient is having difficulty of breathing, whether your patient is having chest pain. Okay, because again, your focus should not be the machine, but it should be the patient. Then other than that, we establish an effective administrative system. Ano pong ibig sabihin ng effective administrative system? Plus, the systems that we have would already include the salary, okay, would already include the benefits of those who are working in the hospital setting. Okay? So for example, kung na-notice nyo, di ba, pag mga nurses naglalagin sa hospital, may fingerprinting na yan, no? Dati-rati time card yan, yung parang pinapunch, time card tawag dyan. But currently, we already have your biometrics, no? So, by the time that you log in, by the time that you would log out, that would already go towards the system, and then the system will automatically compute for your salary. Okay? That's already part of informatics. When it comes to patient care, ano naman yung nangyayari, no? For example, mask. The very typical na lang example, mask. Sa hospital natin, halimbawa, may 200 pieces ng mask. By the time, class, na naset mo sa system mo, for example, pag 50 pieces na lang ang mask, mag-a-alarm. Okay? Class, you will be prompted that you need to order additional mask. Okay? Pero class, it's not really on the end of the nurses na nasa station, pero this is more on the administrative office. Okay? Because class, it is the administrative office that would ensure that there are sufficient amount of supplies in a particular area. Okay? So, we are able to manage the system correctly. Naiiwasan natin na magkukulang yung stocks natin. We are able to prevent that our patients does not have medications for them to take. Okay, that's administrative system when it comes to the use of nursing informatics. Now, other than that, we design useful decision support systems. Class, when I say decision support systems, okay, may definition yan, pero for this time, tingnan nyo lang to, decision support system. Okay? In Hiligay nun, nagasuporta ka decision mo. In Tagalog, sumusuporta po sa decision natin. Kaya tinawag siyang decision support systems. What do I mean by that? For example, if you have a decision support system, you will just indicate in the decision support system, patient has cough for 5 days. Parang kiniklik-klik lang yan, class. Cough, 5 days. Sputum is yellowish. Patient has fever. Patient is awakening at night. Patient is having difficulty of breathing. The decision support system will give you an idea of what to do with the patient. Okay? After you encoded those information, the decision support system will tell you, this is the decision that you can make. You try to administer antibiotics as ordered by the doctor. You give PAI or your paaso natin or your nebulization. Okay? You give your nebulization class as ordered by the doctor. You administered oxygen as ordered by the doctor. That is being given by your decision support systems. Okay? Kumbaga, it helps you decide what is the best thing to be done. Then other than that, we manage and deliver educational experiences. So class, may mga training na po tayong nangyayari online. Okay? We have your lectures being done online just like this one. Then it also enhances support, lifelong learning, and through supporting nursing research. Okay? Plus, if you can see, seminars are being done in the web. Training are also being done in the web. A lot of skills can already be taught in the web. And then, nag-ano na lang class, pagpunta class sa area, pagpunta sa area, nag-actual demonstration na. So that is one benefit of nursing informatics. If I would talk class to my colleagues abroad, yearly kasi class may training sila. And what is being done in their training? So they need to take the lectures online. Then they would need to answer some examinations. By the time that they will go to the hospital, they will just go there for 30 minutes or maybe 1 hour just for them to practice the actual thing. And then after that, done. Okay? So after that, tapos na. That's their training. Unlike di ba, common dati, magti-training ka, 8 hours, nang dyan ka sa hospital, hindi na po yan yung trend. Okay? So the trend is that you're already done using the aid of your technology. Okay? So I will be discussing the topic in the succeeding sessions about more definition on nursing informatics. Do you have any questions so far?